catheters we have. This is type 1, and the commonest catheter which we use is the one which is called Cook 7019. So how we use it at, it's got a syringe attached with it, okay, and then what we have here is an inner and an outer. So the outer sheet is 6.8 French. Like we have gauge in the needles, we got French here. So it is 6.8 French, and 2.8 French is this particular inner catheter. 2.8 French is equal to approximately 1 millimeter internal diameter. So look at this catheter. This catheter has got an outer sheet, and then it has got this hub which we can hold in our hand, and this hub has got a small arrow. See the arrow here?
Yes, sir. Yes, sir.
This arrow will tell us in which direction this thing is going. So in case it is going, in case I get this, now some catheter has got an hub like this, and some have got a depression like this. So wherever we get a depression, we keep our thumb there, and then from the right side we hold it with the left hand, and right catheter goes inside the outer sheet. So in case you look at how it works, now this is I'll pick up a typical Cook's catheter. The Cook's catheter, and this has to go, and this has got some curvature which will also be increased or decreased, and this will go inside the cervix. This will go to the internal os, and this will be at the level of external os. So we just fix it like this so that it doesn't move thereafter. This is the inner catheter. We will load our embryos, and then it will, after we hold it, then it goes inside. The trick here is, simple trick here is that once we go inside, this catheter is a very fine catheter. It's barely 2.8 French, very thin. It won't be seen. And important for us is that we want to make our catheter visible all the time. So we normally load air columns here. We add some air columns here, which will make the catheter visible to us. So we load the embryos and the air columns together, and load embryos between two air columns, so that it becomes sandwiched between the two air columns. And when we push, the air columns are also pushed inside. Air is seen. What is the color of air on the ultrasound? White. In case we see two air bubbles, we can be sure that our embryos have gone between two air columns. For sandwich technique. This is a typical 7019 catheter, which has got an outer sheet and an inner